Most people think a welfare state means the government gives free money to people. That is too simplistic. A welfare state is a system in which the government accepts responsibility for protecting citizens from major social and economic risks. These may include unemployment, illness, disability, poverty, homelessness, old age, and lack of access to healthcare or education. In simple words, it asks, how much responsibility should the government take when citizens cannot meet their basic needs alone? Imagine someone suddenly loses their job. They still need food, rent, healthcare, and support for their family. Without help, one job loss can quickly lead to debt, homelessness, poor health, and long-term poverty. A welfare state may provide temporary unemployment benefits, housing support, healthcare, job training, or help finding work. The purpose is not always to support someone forever. It is to stop a temporary crisis from destroying their life. A welfare state works like shared protection. Citizens contribute through taxes, and the government uses part of that money to support people facing serious hardship. The main areas of welfare include healthcare, education, income support, housing, pensions, disability assistance, and social care. Public health care helps ensure that essential treatment does not depend entirely on income. Education reduces inequality and gives people better opportunities. Income support helps people when wages are too low or disappear. Housing support protects people from homelessness. Social care supports older people, vulnerable children, and people with disabilities. But here's the catch. A welfare state is expensive. Healthcare, pensions, schools, housing, benefits, and care services require large amounts of public money. That money usually comes from taxes. If taxes are too low, services may be poor. If taxes are too high, workers and businesses may feel heavily burdened. So the real debate is not simply whether welfare is good or bad. The real questions are, how much welfare should be provided, who should receive it, and how should it be funded? Some welfare systems provide universal benefits. This means most citizens can access certain services, such as public health care or schooling, regardless of income. Other systems use targeted welfare. This means support is mainly given to people who meet income or eligibility rules. Universal systems are simpler and may reduce stigma, but they are more expensive. Targeted systems may save money, but they can become complicated and exclude people who genuinely need help. Another major debate is whether welfare creates dependency. Critics argue that generous benefits may reduce the incentive to work. That risk exists in badly designed systems. But without support, people may become trapped in deeper poverty. A homeless person may struggle to find work. A sick person cannot become productive without treatment. A child cannot compete equally without food, education, and safety. So, welfare can either create dependency or create opportunity. The outcome depends on the design. A strong welfare system should protect people while creating a pathway toward independence. Unemployment support can be connected to job training and active job searching. Childcare support can help parents return to work. Healthcare can help workers recover. Disability support should protect people who genuinely cannot work. The goal should be security without creating a permanent trap. Welfare is also different from charity. Charity depends on voluntary donations. Welfare is organized through law and public policy. It works like social insurance. Everyone contributes, but only some people need support at a particular time. However, welfare systems can be abused. Some people may hide income or make false claims. Poor administration may also lead to fraud, waste, and incorrect payments. That is why proper checks, clear rules, and accurate data are necessary. But governments sometimes focus heavily on small benefit fraud while ignoring much larger losses from tax avoidance, waste, corruption, or badly designed policies. Fraud matters, but it should not dominate the entire welfare debate. Another challenge is aging populations. In many countries, people are living longer while birth rates are falling. This means fewer workers may be paying taxes, while more retired people require pensions, healthcare, and care services. Governments may need to raise taxes, change pension systems, increase the retirement age, reduce benefits, or encourage immigration. None of these choices are easy. Welfare systems are also affected by recessions. During an economic downturn, more people lose jobs and need support. At the same time, tax revenue falls. So demand increases exactly when the government has less money. Dignity is another important issue. People may need support because of illness, disability, job losses, domestic abuse, or circumstances outside their control. A welfare system should prevent abuse, but it should not humiliate people who genuinely need help. At the same time, compassion cannot replace accountability. If taxpayers believe the system is unfair, public support may collapse. Welfare can also support the wider economy. Benefits help people continue paying rent and buying essential goods during recessions. Public health care reduces financial shocks. Education and training improve workforce skills. So welfare is not only social spending, it can also be an economic investment. However, a large welfare budget does not automatically mean success. The real test is the result. Did poverty fall? Did health improve? Did more people enter employment? Did children receive better opportunities? Did older people receive proper care? And can the system remain affordable? A welfare state reveals what a society believes citizens owe to one another. A very small welfare state may produce lower taxes, but greater insecurity and poverty. A very large welfare state may provide stronger protection, but create high costs, dependency risks, and bureaucratic pressure. The challenge is designing a system that protects people, rewards work, controls abuse, and remains financially sustainable. So the welfare state is not simply a system of free benefits. It is a social contract between citizens and government. Citizens contribute through taxes, and the government provides protection against major risks. At the Learning Studio, we will understand the welfare state as one of the biggest debates in public policy. Because the real question is not only how much money is the government giving people, it is, who needs support? What should the government provide? Does it reduce poverty? Does it encourage independence? How and can the system survive in the long term?